It's his live stream.
Hey guys, what's up? We are right on time, on the dot, uh, despite tech issues. Yay for the 5-day EKG challenge. So, welcome in everybody. We're so excited you're here. And we are on Friday, we're day 5. So, I know I'm seeing a lot of your names, a couple new faces, but a lot of people who have been here with us throughout the week. So, welcome back. And we have a great treat tonight to kick off our session. Michelle Barkley, who is our one of our coaches in our 30-day EKG group, is going to do a game for us. And then she's going to kick it back over to me. I'm going to do our session for the night. And then Michelle has kindly sewed some prizes that she's going to give away that she has made. They are so cute, you guys. Once you see this, you're going to want them. So I don't think Michelle's grabbing them. Got them right here. So
Yes.
she's going to show you. What, you want to show everybody your prizes?
Sure.
They're
Yes.
so cute.
See if everybody can see me. Yes. Okay, so I have a couple of these. We call these little mug rugs. You can put them down for decoration, or you can use them for your coffee in the morning or tea in the afternoon or whatever. Anyway, they all are with zebras on it, and you have to look at the back of these. They have the zebras on the back. Aren't they like so cute?
Oh,
Yes. So I have several of them.
oh my God.
This one is a zebra barracuda. So that one is super cute. I've got several of these.
Wow.
Okay,
Can
and
anyone
I got a couple for paramedics that actually Samantha thought up this new little saying on this one. Someone called for a shot
Oh,
medic.
oh.
That one's a new one. Thanks to
Cool.
Samantha. Anyway, we'll give away about, what do you think, 5 of them tonight, and then
Yeah,
I'll
we're
have
gonna
some for my
give away
coaching.
some of your stuff, and then we'll give away. I promised last night we'd be giving away this painting.
Yay!
Yeah, and then I'm gonna give away some tutoring spots as well. So we will turn the floor over to Michelle, and then I'll be back after she does a game for you to make it kind of a little fun, exciting Friday night. And I'll be back with you guys in just a few.
Okay, and y'all are gonna love the paintings. I have quite a few in my room here, in my little skeleton room, and the rest of them are scattered around my house. So I love them. Okay, so I'm gonna share a screen. Oh, Jen, can you give me back share screen? It's not letting me share.
Oh, I think I need to make you. I will fix this,
Okay,
and it should be fixed right now.
uh, share screen. Oops, hold on. Okay. All right. I think Zoom has done some new things lately, so that's a piece of it. All right, so we're going to start. Make sure that y'all can see this. And you can type the answers in the chat. So you've had a couple of days that I played with this online, and I just did some screenshots for you so you could kind of see how this works. So it's called, do you want to be an EKG millionaire, like from the old millionaire game? And so I love playing this game because it's just kind of fun, and it's a good way to review. I do give this little shout out first because this guy does this as a free thing for anybody that teaches, educators, and so I want to make sure that everybody knows that this is his game, but he allows you to make new questions and change it, and you can see how long I've been using it, since 2000. I just love this game. So I did change it from dollars to points because I don't have $1 million. Sorry about that. So gather up your points and keep track of them. And then we'll do at the end of the day, we'll give some mug rugs away, and we'll just say hashtag EKG millionaire or something easy to type in. So here's the first question. The P wave, and type in either Facebook or chat, or the chat in Zoom, either one. I'll keep an eye on both of those. The P wave, or the sinus node, is upright in one lead specifically, and inverted in another lead. So this is one of the leads that we look at specifically to say, is this a sinus rhythm or not? So what lead, and I gave you some choices here: A, lead 2 and V1, B, lead 2 and ABR, which would be upright in one and inverted in the other. So that's how those are written. ABR and V7, or lead 1 and V1. And Nesrian, I'm not sure if I'm pronouncing that correctly or not, but let me know. Nesrian is in the chat, and she got that typed in super fast. She said lead 2. There we go. My little thing was not right. Okay, so lead 2 in AVR. So upright in lead 2, upright in lead 2, and inverted in AVR. So that's important because when we're looking to find out if this is a sinus rhythm or not, that's one of the things that we can look at to say, is it sinus or not? Okay, so, all right, here we go. Here's another one. I'm concerned about these intervals, and I have the intervals up there on the top of the EKG, so you might have to like zoom in on that and see those. But look at those intervals. I'm concerned about it. What is normal for a PRI? PRI, I said that correctly. What is normal for a PRI? Oh, good. I did pronounce it correctly. Thank you. So what is normal for a PRI? 120 milliseconds to 200, 60 to 120, 60 to 100. So I've got some people typing in fast. Super good. Vanessa's typed in A. Debbie is A. Versad is A. And then we've got some more on Facebook Live. Sophie, Joyce, and Marissa. Yes, y'all are right. It is 120 to 200. And I think somebody asked this question last night where the verbiage is not any different if we say 0.10 to 0.20 seconds. It's just the difference between seconds and milliseconds. That's all that is. Okay, so that just makes it a little bit easier. And so have a new little picture up there on the top, and there's a reason for this. So listen to the question. Lateral wall MI is coming into your cath lab. So a patient's coming in and you are suspecting that they have a lateral wall MI. What contiguous leads, so Jennifer talked about contiguous leads. What does that mean? We have to think, what does that mean? What contiguous leads would you be worried about? And there's a reason why I have a horse up there with zebra stripes. What would you be worried about? Yes, I have some answers already. And Marissa, I've got Madeline. I've got a couple people already typing this in. Look at it and see. I just want to make sure that everybody gets a chance here. Joyce. Okay, we've got a couple more typing in. Oops, I went back too far. Yes, leads 1 and AVR and possibly V5 and V6. So for those that might not quite understand what that word contiguous means, I just want to give a thought process on that. And I love, Tanya, thank you. I love the way that David says this, and y'all haven't gotten to meet him yet. He does a lot of our study halls, and we call him our Mandalorian because he's like so smart with EKGs. He likes to call these contiguous leads as kinfolks. If one kinfolk says, hey, I'm looking at that and I see something, the other kinfolk that's very close to you would be saying the same thing. So two people looking at the same wall of the heart are contiguous. So those leads, 1 and ABL, lead 1 and ABL are contiguous leads, as well as V5 and V6. And you see how I do that on my hand. Lead 1 and ABL looking at the lateral wall. Lead 1 and ABL looking at the lateral wall. Okay, so let's do another one. That lateral wall, okay, still talking about that lateral wall, that's coming in, what coronary artery? So if I'm looking at my lateral wall, and here's my little heart that I like to use. If I'm looking at the lateral wall of the heart, and I know that lead 1 and AVL are looking at this lateral wall, which coronary artery are we looking at? And Joyce, boy, she typed in fast. I've got Joyce and Madeline typing. Oh, y'all are so fast. So fast. Vanessa, like y'all are so typing so quick. I can't even type that fast. Y'all are good. Oops. It didn't let me. Okay, left circumflex, yes. If you look at on my little heart here, here's my little heart, here's my front of my heart, here's my left circumflex, and my lead 1 and AVL looking at that lateral wall and my circumflex artery. That's how I remember it. 1 and AVL looking at my lateral wall and my circumflex artery. So that's my favorite way to remember that. Okay, well, we're 1/3 of the way there. All right, let's keep going. All right, what do you think about this rhythm? I'm going to give you just half a second Diagonal off of the LAD. Yes, yes, Joyce, you are right. Sometimes it is a diagonal off of that LAD. That is very true. And we go into more detail into that, and I kind of break it down a little bit more, especially with V5 and V6. We're not really sure exactly what we're seeing when we see those. But when we talk more about more specifics on the leads, I look at more of those diagonals and those septal branches that are coming off of the LAD. So yes. Okay, so we've got answers to this one already. Y'all are so smart. All right, AFib. I've got Joyce is typing in AFib. Yes, you are right, Joyce. Marissa, y'all are quick to the typing. So this one's AFib. I did try to make it a little bit easy. And what do you think about this one? This was one that Jen talked about. I think it was Wednesday, if I have my dates right. 42-year-old male, syncopal episodes times 3 in 24 hours. What would be on your differential? What would be on your differential if a patient is coming in and he's already had syncopal episodes? Not that this is the only thing on your differential, but what would you have on your differential? Marissa, Natalia, yes. I recognize your name, Natalia. Joyce, all right, y'all are fast. Fast. Yes. Brugadas. Yes, Vanessa, you are correct. WPW is also on the differential. What I wanted you to see on this one, on the EKG, is that I put up V1 and V2. And the way I remember this, because I can never remember the word brugadas, like how does that have to do with syncopal episodes? Because it's a person's name. So the way I remember it is it's brr. That helps me remember the word brugadas. Brr. And it's cold in the V leads, and those are where we can see somebody skiing down that ski slope look in the V leads. That's just how my head remembers it, because I'm very visual and I need those visual reminders to get my head going. Okay, y'all are right. Joyce, Sophie, Kiki, you're here. Awesome. Are you all tucked into your new house? Okay, what is on your differential on this one? I'm going to give y'all a second to look at it. I want you to look at something specific on this. Person came in with shortness of breath. They're a little tachycardic, as you can see. They, excuse me, this person also had been on, oh, Natalie, you are fast. This person had also been on a flight. So that was another key that was asked, and they had gone to a place that was a little bit high altitude. So they were a little bit dehydrated, high altitude, and yes, y'all all have it. Possible PE S1, and I circle the S in lead 1. Q3, which means I'm seeing a Q wave in lead 3, and a T, which is inverted, shouldn't be inverted. T's should not be inverted in any other lead except AVR and V1. So it's inverted, and I'm seeing all 3 of those. Okay, so which coronary artery, and I'll bring this back up so we can see. Somebody's going to be fast at this one, I can tell. Oops, did it go away? There we go. Which coronary artery perfuses that septal and anterior region of the heart? The front of my heart, my septal and anterior region of the heart. And I'm going to bring my other little small one up here so you can see it. That septal and anterior region of the heart. What are you thinking? Yes, Debbie and Mersad, Madeline. Oh, y'all are typing so fast I can't see. Vanessa, everybody's, oh, y'all are getting this one. Yes, LAD. The LAD, that front wall of the heart. And again, when we talk more into the 30-day, I go a little bit more specific and particular on where these arteries are looking at and what we're looking at on the specific wall of the heart, what they're supposed to look like in every lead. Like, what does lead 1 look like? What does V leads, what does each of the V leads look like? Okay, I digress. The left main artery, so back to our left main artery, specifically coming off of that coronary sinus up here, the left main artery bifurcates into 2 different things, 2 different coronary arteries. It bifurcates into 2 different coronary arteries, and which 2 are those? I'm looking at my typing here. Oh, Tori, it is fun, right? I know, I love this. And the fact that I always tell people, nobody plays games with me, y'all. So my kids play games, but my husband won't play games with me. So I have to play games with y'all. So yes, y'all have it. B, the LAD and the left circumflex. So that left main breaks off into the LAD and the circumflex. So if I was to see, we are up to 32,000. We are almost there, guys. We're almost to 1,000,000 points. If you see ST elevation or ST depression, either one, in leads 2, 3, and AVF, and I kind of make this F sound figure with my fingers, in leads 2, 3, or AVF, if I saw ST elevation or ST depression with those, or if I saw ST elevation or depression in leads 1 and AVL, what would I call that? We talked about it a second ago. What would that word be used? What is that word when I am looking for something, when I'm looking for something in all those leads? I want to say, is lead 1 and AVL, are they both looking at the same thing? What is that word? Hopefully I'm making myself clear in my question on this one. If I looked in leads 2, 3, and AVF, and I see the same thing in all 3 of them, what is that word that we call those leads? Maybe I should ask it that way just to make sure, because I want to make sure I'm not misleading you. Yes, contiguous changes. I can see where you're getting STEMI from, so that would not be a wrong answer. But what I was trying to get across was the word, that new word, contiguous changes. And we keep saying it over and over again so that we use that verbiage. That's why I'm using it over and over again. Okay, so the picture on this one's a little hint. What do you see? What do you think about this one? Patient is coming in with chest pain. He has chest pain about 8/10. And he's had it for about an hour and a half, 2 hours-ish. He was at home. Wife brings him in. And this is what you're seeing on that. What are you thinking might be happening with this patient? What do you think might be happening with this patient? Is he having a heart block? Is he having an anterior wall MI? Is he having a possible posterior wall MI? Should I get a V7, V8? Or is he having a septal wall MI? What are you thinking on this one? Sophie says C. Sophie, yes, you are right. And you are a fast typer, girl. It is a possible MI from the posterior. Keto, yes. Kiki and Joyce, yes, perfect. So where we see the posterior wall, we don't ever look at the back of the heart. Here's my back of the heart. We hardly ever look at this. And that was my little key there. I put a little picture of the back of the heart there. I actually did a couple of lessons where we drew the heart itself. This was my little drawing. And then I draw the coronaries on there. And this is an area that we don't pick up on. We don't know, like, how do we look at that? And we're going to look at it in V2 and V3 because we're seeing ST depression. We should not see ST depression in those V leads. We are now seeing, let me give you another word, reciprocal changes. We are now seeing reciprocal changes. Okay, we only have 3 more questions after this one. All right, what is your interpretation? I'm going to let you look at that. Am I having a lateral occlusion? Am I having something in my posterior wall? Am I having something in my inferior wall? Oh my gosh, y'all are so fast. You already typed it in. Or the anterior septal. Oh wait, I'm not, sorry, that was the last one. Are we having anterior septal? Yes. Sobha, am I pronouncing that right? Sobha and Vanessa and Emmy and Joyce. Yes, we are having an anterior. So my anterior wall, the front of the heart, my septal wall, this little branch is coming off of that LAD, and my lateral wall. I may even be having something going on, an occlusion in the left main. So we're not really sure until they get to the cath lab. Tanya, yes. Marissa, awesome. Y'all are fast. Okay, 3 more questions. You're up to 250,000 points. Okay, and these are the things that we would go over obviously a lot slower when we're practicing, when we're playing, These are just something to get your brain going like super quick tonight. All right. So what do you think about this one? What are you thinking about this one? Where is my patient maybe having some issues? Are they having some inferior ischemia? They having reciprocal changes with ST elevation, lead 1 and AVL? How about V4 and V5 with large T waves? Or are they having an anterior septal MI? What do you think is actually going on with these patients? What are you thinking? I'm going to give you just a second. I didn't make it super easy. This one was hard because it's our 25. Oh, Madeline, you got it. Yes, this patient is having, and so Sobha, I'm hoping I'm pronouncing that right. Marissa, awesome. Yes, this patient has ST elevation in lead 1 and AVL. Remember, those go together, lead 1 and AVL. And that is looking at the lateral wall of the heart, but they're also having reciprocal changes or the opposite wall of the heart. And I have to say this, so this is how I usually have to remember this, is this part of the heart is having a heart attack. Oh no, I'm having such a bad heart attack. It's very bad and I'm going to have all this ST elevation. The opposite wall is going to be very depressed. Oh, I'm so sorry. This is my inferior wall. I'm so sorry. I will be depressed for you for 24 hours and we will call that reciprocal changes. And that's how I remember it, is that one wall is reciprocal to another. So I should see the opposite on those walls. Okay, we're almost there, guys. 500,000 points. What do you think? Jennifer did this one last night. I put the little zebras there because it makes me look at those leads. So I want you to look at those leads. I want you to look, oh, thanks, Marissa. I want you to look at the lateral leads. Why am I wanting you to look at those lateral leads? What could be happening in those lateral leads? What do you see different in those lateral leads that we should not see there? I should not see something in lead 1 and AVL and V5 and V6. I should not see them. Yes, Joyce, Brenda, yes. Sobha, yes, it is Holcomb. That patient is coming in. If I would have given you the scenario on this guy, was a young guy came in with syncopal episodes. He was having Holcomb because he had Q waves, and we should not see Q waves. We should not be able to see Q waves in lead 1 and AVL and V5 and V6 in those lateral leads. Yes, Brenda, Q waves. Yes, yes. So that's why the zebras are there to help us remember, right? Okay, we are it. Yes. $1 million, a million points, $1 million. I don't have $1 million. Sorry. 1 million points. 42-year-old guys driven to the ER for chest pain. And I'm not positive Jennifer went over this one. So that's why it's the million, but it is something that we talk about quite a bit. And it's again, one of those zebras. That's why there's a little zebra down there. So you can probably throw out the ones we haven't talked about yet to make it a little bit easier. But what are you seeing in there? What is wrong with these crazy T waves? What is wrong with these crazy T waves? Marissa, you got it. Awesome. Marissa is my first one that I see typed in the chat. This is Wellings. This is Wellings. Joyce, are you seeing Brugadas in the V leads? Did that look like a ski slope there? That's actually a really super deep T wave in that V2. Almost looks like a bundle branch block that patient has. But that deep V looking thing that we're seeing in V3, V4, V5, that deep well, that's how I remember it. That's how I remember Wellings, is I'm looking down into the well. And usually you have an up and a down. You have an up and a down. There's a couple different scenarios of it, and I've got it over there on the left where you can kind of see that deeply inverted T wave. So we made it to the end. You are all now EKG millionaires.
So,
okay, Jen, I am turning. Okay, I stopped that one. All right, so we're back to Jennifer. Yay!
oh my gosh, Michelle, that was so fun. I think that these guys really like your games. I'm getting the vibe that lots of folks are super stoked. So thank you for doing the game tonight to make it so much fun for us at the end of what's probably been a long week for everybody. So As you might have seen, Michelle has some prizes we're going to give away at the end. And then actually, I'll have some prizes as well. But we're going to jump in to day 5. And we're going to share today's case with you. And this case, I saved it for last because literally it is the best case. And this was, if you got to watch this morning at 8:00 a.m., this was a 38-year-old female. This was a real case that actually happened, who went to urgent care for a cough. Now, this was pre-COVID, and as you know, she probably wouldn't even get into the urgent care now with a cough, right? She'd be in the parking lot getting a COVID swab before anybody let her in. But in the meantime, here she is, she's got this cough, dry, and, it's a Friday, and she's like, well, I'm a school teacher. I got to get better because I got to go back to work on Monday. So I'm just going to go ahead and get myself a Z-Pack because that's what people do, right? I mean, how many of you have been asked for a Z-Pack in the last week? Type Z-Pack if you've been asked for one. I can say that for sure, at least twice this week. And I work in one day in the ER and the other's in cardiology. So that's saying something. So here she is. And, what's interesting about this case, a real case again, that it was almost missed. And I really believe in my heart of hearts that anybody could have missed this because we're going fast, we're moving quickly, making fast decisions on very little data because unfortunately our schedules are packed, right? No matter where you work. And I asked the provider who saw her later if he would have gotten an EKG on her, and he said, no, I would not have. So she goes into the ER. So let me just back up. She's in the urgent care. She says, yeah, I've got this cough and this shortness of breath. And they said, well, let's do a chest x-ray. So they get a chest x-ray and it was abnormal. They thought she had a pneumonia. So they said, go to the ER, get yourself some IV antibiotics. You've got, I think it was a left-sided infiltrate and, you're a little tachycardic. So you should just go to the ER. So she goes to the emergency room and you can see that her EKG screening was abnormal and she's tachycardic. So one of the very first things we should think of with a dry cough and tachycardia, yes, we got to think about COVID now, but before we had to think about pulmonary embolus, right? So that's on the differential. And there's 5 clues you can look for on the EKG for PE. She doesn't have a lot of them, which is good, but they still checked her for a PE anyway, because that's reasonable, right? They had a unilateral abnormality on a chest x-ray, and it could have been a wedge-like density. It could have been, right? So they looked at her legs and they were like, oh, you've got some leg swelling. So then they elevated their threat risk even higher, but it was bilateral, it wasn't unilateral. So she also says, I'm kind of tired. I've got some dyspnea on exertion. She doesn't say dyspnea on exertion, but she feels short of breath. So here's her screening EKG. And I just want you to look at this for a second before I draw some lines on it. But let me ask you what you would do with this patient who comes to the emergency room with an X-ray that says she's got pneumonia and an abnormal EKG. What would you do? Well, option A would be send her home, give her some antibiotics, send her home. Option 2 would be get some blood work and give her some antibiotics and send her home. Or option 3, see what the labs say and then make a decision, right? So definitely want to do option number, I hope you guys all voted for number 3. So we're going to order some labs on her, and we're going to get a CBC and a CMP, and we're going to get a troponin. Yes, she's 38. Can people have young heart disease? Absolutely. Absolutely. Okay. So we've got a troponin cooking. It's normal. And because of her leg swelling, we also add on the very beloved BNP. Okay. And the BNP is markedly elevated. Her chest x-ray is read by the hospital radiologist as a left pleural effusion, not a pneumonia. So clinically, what do you think now? Based on your elevated BNP and her leg swelling, right? it's probably not pneumonia. In fact, the radiologist doesn't think it is. So you have the CKG, and it says that there are some non-specific, actually, let me go back here. Let me point to here. It says there's some non-specific ST wave abnormalities. So Brenda says needs an echo. I agree. That's one of the tests that she will get. Absolutely. And Joyce, yes. But let me show you something that's not quite obvious, and something that I know. Hey, Chris is here, back from camping. What's up? What's up? So just to go back really quick, she has the non-specific ST wave abnormalities. There is at least 5 things that we teach in the 30-day program that when the machine says non-specific ST wave change, what you need to look for. I'm going to show you one of them tonight, and this lady has one of the bad things. So what you need to do is you need to draw her ST segment, right? You need to draw it out, and you need to see if there's ST segment elevation or depression. Now we do this on all the leads, right? We make our straight line all the way across so that we can see if there's at least 1 millimeter of ST elevation or depression. You can see right here when you make your line that all sorts of ST depression starts to come out, right? And there's also some elevation up here in AVR, okay? And a little bit of ST depression in AVL. So it doesn't look like that big of a deal when you first look at it. But I want to tell you guys that this is actually a huge deal, because all you need is 1 millimeter, which is one small box of ST deviation. If you saw Gary talk, he talked about ST deviation, and that's basically elevation or depression, either way, okay? So this lady has a pattern of widespread ST depression with elevation in AVR, which is a pattern of a severely diseased left anterior descending artery. Nowhere on her EKG does it say that. Nowhere on her EKG does it say send her to the cath lab, right? Nowhere. And Joyce says maybe pericarditis. And pericarditis actually comes with, it's a similar thing, but instead of being depressed, they're all elevated, right? So pericarditis is that widespread ST elevation, whereas these are a widespread depression. So indeed, this is a picture of an LAD occlusion. But wait, you said she's 38, Jen, and I don't really understand how this is possible on a 38-year-old female. Well, it turns out that she actually got a glucose and didn't know she was diabetic. She was diabetic, and she also had something called familial hyperlipidemia, which made her at risk for sudden or for young early coronary artery disease. So these two things in combination worked against her, plus her genes, right? Her family history was positive for young cardiac disease. And so those 3 things were unfortunately setting her up for disaster. So she got the CTA no PE, she got the nuclear stress test, and it showed what we already suspected. She had a severe LAD occlusion, which we showed you. That was exactly, hey, beloved Cheryl's here. We showed you that's the pattern. And then the RCA occlusion, and she had a depressed ejection fraction. So anything under 55 is low. So she had heart failure because of all her coronary artery occlusions. So this is a game changer. Yeah, good question. Was it safe? So they felt that it was safe because they did stress her in the department. When they admitted her, they stressed her. And so when it's a good thought though. I like where you're heading with that. Sometimes we would do it, but they had to get the data right on why was she in heart failure. And so they got the data. They found out that she had low EF with at least 2 vessels that were diseased. So where did she need to go next? Where did she need to go next? She actually needs to go get a cardiovascular consultation for a cabbage. So when you have multiple vessels with depressed ejection fraction, you're a candidate for CABG. So she was 38. Yes, Joyce, exactly. She's 38. And Brenda, cath lab, exactly. And she got cath. That was a true Lexiscan finding. It was actually corresponding that she needed a bypass. So this 38-year-old female had a CABG. She, I think, honestly, if you go back, I think she would have been missed almost every day of the week. Almost every day of the week. Because I'm going to ask you guys, in your heart of hearts, would you have picked this up before this class? Would you have picked up this non-specific ST rib depression, right? Would you have picked up the 1 millimeter of ST elevation in AVR? Would you have said non-specific and just referred her to cardiology, right? Because most people would have, right? Most people would have. So, and that's an honest thing, right? That most people don't pick up this finding, because it's not because you're not smart people. It's because we're not teaching it. Sobda, thank you. I appreciate it. And I'm sure Michelle also, with her questions was kind of thought-provoking too tonight, which was really fun. So in a nutshell, you guys, this is a high-risk EKG. She had an unexpected finding, right? Yes, with the finding, we're like, yeah, it's an LAD at the very least, which she had, but on a 38-year-old, you're like, what? But when you put it together with the risk factors of familial hyperlipidemia and poor genes, right, being passed down, early heart disease in her family, probably because they all had FH, and the diabetes that she didn't know about and wasn't controlled, she was a setup for this to happen. So she's doing well now. Joyce, I'm glad you won't miss this. I'm so glad. She's doing well now. That's a happy ending. And she reversed her diabetes with losing a bunch of weight. And she's got her cholesterol under control. And she's doing phenomenally well. Still alive and kicking and doing great. But I often wonder, what if, and it was a nurse that saved the day. What if the nurse didn't get the EKG when she came in? The doctor said later, when I asked him, he wouldn't have got the EKG. He wouldn't have got it, because you don't think about this with a 38-year-old, right? You just don't think there, but you have to keep an open mind and really think about this. So my take home for this whole challenge is that what is the most dangerous, riskiest thing is actually the one that is so benign, right? Because until this class, when you saw non-specific, you were probably like, oh, that's, I don't know, I don't see a STEMI, so it's fine, right? But it's not fine. It's really not fine. So, and Michelle echoes my sentiment. She says, have a low threshold to get an EKG. And that's so true wherever we work, right? Wherever we work, have a low index. Now, there's a whole list of things. If you're like, I'm convinced, oh my gosh, I just opened Pandora's box in the EKG world. Like, I feel super good about the first couple days on the EKG challenge, but now I'm like, whoa, wait a minute. This is blowing my mind. I'm going to add some more fuel to that fire. Because if you remember on day one, when I told you, hey guys, there's a bunch of dangerous things that I wrote down to study and figure out, this was part of my list. Right? So remember when I said I didn't want to go another day without knowing these high risk findings, because I didn't want to miss anything and get sued and my patient to die. So I went home and I studied. And I just was like, nobody gave me this list. I made it up myself, because honestly, nobody was teaching this at the time. Right? And I was like, okay, what can kill somebody that I need to know? So posterior STEMI, we need to catch that, right? 2-to-1 atrial flutter that we think is sinus tach, we need to catch that. Joe kind of touched on it a little bit. We need to catch PE. We need to catch hyperkalemia. There's actually 5 findings on the EKG with hyperkalemia. We need to make sure to not call a STEMI when it isn't, right? Like pericarditis EKG on night 1. And we need to look for the other 4 things that are caught in non-specific ST2 wave garbage that our EKG often reads to us. We also need to pick up a pericardial effusion. That would be a really good thing too, right? Someone who's in tamponade. So if you don't want to research this on your own and you want help learning these in a very short amount of time, then consider missing it. Consider joining us. So no, it would have been easily missed. We've seen young patients with stroke And it's not until we screen for risk factors and we find the abnormalities. Young people like this also present with atypical symptoms. Exactly. I totally agree, Grace. Totally agree. So if you are, if you have somewhere to go or plans tonight, we want to thank you for being here with us from the bottom of our hearts. We've enjoyed spending this last 5 days with you. And a little surprise, I'll be doing a little bonus session sometime next week for you guys, just a little snack, either Tuesday or Wednesday. I have to see what day is going to work better, but I'll be doing a little bit more, so it's not goodbye. And we definitely don't want it to be a long-term goodbye, because we want you to join us in our class that starts on Thursday next week in the 30-day EKG challenge. So we're going to do a giveaway. We have lots of prizes tonight. We have, of course, I showed you this painting. We have Michelle's mug rugs, and we have a couple tutoring spots that I'll be back on to draw for afterwards. But let me really quickly, for anybody who has gotten what they needed from this class, we thank you for your time. This is the part where you exit stage left, right? But if you're interested in potentially wanting to see more about our 30-day, I'm going to spend about 5 minutes talking you through what the course looks like so that you can make an educated decision. Now, we had some people join us already, and we're welcoming you with open arms. Your kits have already been mailed out. I do not waste my time. There is no grass growing under my feet. But basically, we designed this course so that you could, yes, you're welcome, Nasir, and I'm glad you really got a lot of info out of this tonight. We're going to take you from feeling like you hate EKGs and that you're stuck and that you're alone and that you need help. And within the first 2 weeks, we're going to run you through basically 4 classes that are going to get you up to speed very quickly, right? We're not, again, no grass grows under our feet. We're going to have some study hall time, practice with the coaches, where you get to practice with Michelle, and you got to meet her a lot tonight, and she goes over the 12 lead or the 10-step system on 12 leads. And then we get 6 months of you getting to absorb all the content, right? So you get to absorb everything we've done for the last 2 years. In 6 months, you can go through it all, right? But in the first 30 days, we give you the meat and potato, the nuts and the bolts. And Esperie's here. She's been in our 30-day for, I think, like 2 years now. And she's now become an expert, actually. She came in as a baby Yoda, and she is just amazing. You guys should see her go. All from being in this group, but she also studies a lot too. She studies a lot. So here's what's coming up on the calendar and for where we're going to start. So if you join us by the 7th, you'll be here for our welcome call. And I got to tell you that every time we do this challenge, we have people who literally join like the day of or the night before. And because we know you're going to spend, your holiday weekend doing whatever, but next week you're going to be like, oh my gosh, the 5 days not on. I want to learn more. And people will approach me and they'll be like, okay, where can I find out more about this 30 days? So I'm just going to tell you now, you can rewind and watch this that's you, if you're a last minute person. But we do the welcome at 4 o'clock on the 7th. And then we do basic arrhythmias on the 9th. And then the 10th, that's at times actually wrong. I got to change that. On the 10th, we're going to do a 3-hour, 2 to 5 p.m. PST, all times are PST. We're going to do a 3-hour hands-on workshop. You can either come here, because this is the same content I'm going to do broken over 3 Thursdays. So if you want to spend a weekend and do it all, you can do it here, or you can come once a week on Thursdays and get it all as well, in just chunks. So we're doing it 2 ways this time. We normally don't do that, but we're doing it 2 ways this time. So you can do either way. And then terminology, we're going to cover that on the 11th. We're going to have a sleep apnea bonus lecture if anybody wants to come, and about sleep apnea by our sleep NP. And then we have a study hall with Megan, who's our cardiology NP. And then on the 15th, we have a hands-on 1.5-hour class with Michelle, who's going to go through in a way that's so user-friendly and so engaging. She's going to go through her 12 lead with worksheets and everything. So you'll get to see her camera approach to the EKG. And then you get to practice with her over the next 2 Mondays on the 18th and 25th. You get to be on Zoom with her, practicing the 10-step approach. And it's just like the Millionaire Game. She's encouraging you. She's cheering you on. And then, of course, we have Gary coming back to do the 12 lead lecture, just like the one if you came Tuesday for the bonus, you got to see, but he does the same thing with 12 leads and spends about an hour running the drills with us. So as you can see, at the end, we wrap up with the study hall where I go through how to document, how to do differentials, how to work up different complaints. And so you can see you get, in just 30 days, you get a lot of exposure. And the great thing is that if you don't catch it all, they're recorded, all except for Gary's, right? Everything else. And it's stored in the guide section, just like this. So you'll get to go back and watch whatever you want. And we also have other lectures throughout the 2 years we've been doing this that we have stored. So like a lot of people join and they're like, hey, I want to watch an AFib lecture. We tag them in the AFib lecture. Hey, I want to watch something about stress testing, how to choose a stress test. Cool, we tag you in that. Hey, I want to learn about the paper speed. I want to learn about P waves. I'm a neonate, like Esprit said she was. Yeah, we tag you. Like whatever you need, we show you where it is. It's a very customizable thing. And Esprit says she likes to go back and watch the videos. So this is actually, this is literally our first 2 weeks together. You have all this stuff. So we take our momentum from this week and we hit the ground running and we're like, let's go. Let's teach you all of my secrets. I share them with you. Michelle shares her secrets. We don't hold anything back. Designing this program to get you super confident and good. And then you'll get to meet David, who, if you submit EKGs to him, he will put them in a PowerPoint and he will break them down for you. So that's what study hall is. And you can ask him all the questions and he's like the master. There's no EKG question that you'll ask him that he won't be able to answer. So imagine having access to recorded content, but live instruction. Like, where is doing that right now? Pretty much nowhere that I can think of. So it's a great opportunity. You get the access to how to measure all the arrhythmias and the waves. Yeah, beloved, I know. Yeah, you're totally gonna love it. And so sometimes people have stuff that happens, they fall off the map for a little while, then they jump back in. That's totally fine. That's why we give you 6 months. We used to just do this for 30 days. And we were like, no, people need more time. But if you want to get good quick, you can do everything in the 30 days if you want to. So set the 7th, this is what we're covering in EKG 101, right? The waves, how to measure, the arrhythmias, and then we do EKG 102. These are the Thursdays, right? And what artery feeds where, how to use the intervals, reciprocal changes in contiguous leads leading up to STEMI. And then the 21st, we do ACS night, where we talk about STEMI recognition. What is the criteria? What are we looking for? And all the things that are subtle ACS that are not yet a STEMI, and how to not miss these so that you don't send the patient refer to cardiology and they die while they're waiting for their referral. It's happened. You need to be able to spot these things. So we teach you these high risk things. And then of course on study hall, we're going to talk about the differentials for the big chief complaints, how to write a differential note really quick, and how to choose the testing, and how to give a really snappy report to sound awesome to your collaborating doc if you work with one. So that's what that's going to be in the study hall the very last day. Okay. And then you get a whole bunch of other stuff too. You get access to all the past 2 years. So we have things like deep dive on the anticoagulants, how to answer triage messages. We have a lipid specialist who comes in who talks about how to get the new medications covered. She actually works in a lipid clinic. She brings cases for us. She shows us how she would treat lipid cases and, talks about how to read lipid panels. So like, you want it, we got it. We have a stress testing lecture, a couple of them actually, how to read an echo report and make sense of them, new CHF guidelines and how to use new drugs. We even had a billing and coding lecture last 30 days. So like, this isn't even a hard list. There's a long, long list. I could go on forever, but I don't want to bore you, but pretty much you want it, we got it. And so what do you get when you join us? You get weekly live classes. You get access to our neonate group where we do classes on Monday. It's called the EKG Launchpad, where we just do basic things. So like if you're a neonate and you just want to swim in the shallow end, you could literally just watch stuff in the Launchpad for a while until you get your land legs, right? Or you could jump into both groups and, just see what you can absorb. But you also get a welcome kit sent out to you. You get 12 hours of category 1 CE, and you get the bonus hands-on workshop, which I do on the 10th, but I also do it over the 3 nights on the Thursdays. And you can join for as little as $127 for 6 months, which is a steal, right? And you obviously, if you need CE, that price goes up. You can just click on the button. I think Tori and Michelle are probably putting in the links for us, but that's what's so cool. Esprit says you can pick and choose. It kind of is like a choose your own adventure. If you need CE, you just have to watch the classes for CE. They're all in a learning portal for you to make it easy, that you get instant access to, but you also get access to the groups where there's a ton of stuff. And you get lifetime access to what is in your portal, the 12 hours of things. So even if you don't continue on with us, then you get access lifetime to those 12 hours of CE that you can rewatch if you want to. So that's pretty cool. So you get access to this group, you get access to this group, you get John mailing you an EKG workshop kit, which has lots of goodies in it, EKG tools. Yeah, Sophia, we would love to have you. Where do you join? We're going to put in a link. You basically go to the link that either Tori or Michelle will drop for you. You pick which way you want to join. If you want to join as a student with no CE, you pick that one. That's the least expensive way to go. But if you're an RN or PA or NP, you pick that button if you want the CE. And then we get you the access to the groups, and you get instant access to your learning portal. So that's how to join. Tori just put the link. Thank you so much, Tori. And we also have other stuff in here too, like pacemaker lectures, how to read the pacemaker reports, valve disease. Like I could go on and on. There's so much stuff, right? Like if you're interested in something or all of these things, we can tag you in whatever replay you're looking for, but they're all stored in the guides section, which is kind of cool. Okay, so then the last thing is, of course, these study halls. We have access to these. Megan's doing one, I think I mentioned, I'm doing one, and David's doing a few. He also does it for in August as well. He has more, so you'll be in with August as well. So we get to come to his study halls as well. So does the CE work for medics? Yes, it does work for medics, actually. It's a California-based CE that we give through Monterey County, and you just have to do a post-test and an eval just like any other CE, and we got you. Absolutely. So for EMS, it's only $149, which is a smoke and deal. Students, if you don't want CE, you join as a student, or if you're a student, right? It's a $127 package, and RNs is a $199, and PA or NP is $249. This is actually the least expensive we've done it for in a very long time. We kind of pared back a little bit for the summer, so we don't overwhelm you with too much content, so you can still have fun, but still get good at EKGs. And then if you miss a few sessions, you have 6 months to do the CE forms. So you hang out, check out what you want to check out. If you're like, oh, that day I'm busy, I'll come back in August and redo that class, right? Or I'll rewatch it later. You can do that. But we just want you to have access to us, access to the wonderful people in the group. You see Espery's on here with us, and that's what's so cool. A lot of our group members, just to be really quite honest, a lot of our group members are really like family now. We have people who've been in with us for the whole 2 years. They just don't want to leave, which is great. And we love that. In fact, we often meet together actually outside when we go to conferences. People will come just to hang out with each other. So we kind of like each other in this group, right, Michelle? We kind of like each other.
We do. We love hanging out with each other. We love going to California. We love coming to San Antonio and hanging out at the Riverwalk or at my house having a barbecue.
Yeah, we go to Michelle's house. So we invite the 30 people to come to Michelle's house. But anyway, if you want to join us, the link's in I think probably Tori put it in both places. And we will be, if you're joining us, we'll be welcoming you. And I want to see you on that welcome call. I want to see your face. I want to celebrate you on Thursday the 7th. So I'll see you back. Michelle has a tutoring. So if you want tutoring with Michelle, that's on Sunday. If you want to win a small group tutoring with me, that's one of the prizes tonight. So let me give you the hashtags, okay? And then it's going to take me a while because I know I'm going to have to write some separate names, okay? So if you want to win the mug rugs with Michelle that she's giving away, put hashtag Michelle. We're going to do a separate drawing for that. Hashtag Michelle. If you want to win a mug rug, okay. All right, Vanessa's in. Okay, good, Vanessa. And then if you want to win the painting, hashtag painting. This is actually a custom piece of art that I painted this week, actually. So there's no other one like it. When I die, it's going to be worth a lot of money, pretty sure, but not before I die. And you know how artists are. And then if you want to win the small group tutoring, okay, put hashtag tutoring. Hashtag tutoring. So I'm going to use your 3 hashtags. I'm going to put you in 3 different bowls, and we're going to come back and we're going to do the drawing. I'm going to come back onto Facebook only because it's going to take me a while to write all your names. Okay, so Awesome, you guys. We'll see you in a few. If you have any questions, don't hesitate to reach out to me, Michelle, or Tori, especially me over the weekend, because I will be monitoring the chat if you guys have questions about how this works or anything we didn't cover. And I look forward to announcing the winners in just a few minutes. So
Hey,
awesome.
Jen,
Yeah.
Debbie had one question, the
Oh,
hashtag again. You said Michelle, painting, and tutoring, right?
yep, that's right. Exactly. All right. Awesome. So I'll be back on in just a few minutes to do the drawing. Good luck to everybody. I'm super excited to see who our winners are, and I'll be announcing them on Facebook. So I'm going to hop off and I'll see you guys back in like 10 minutes. Okay. All right. Thanks, Michelle.
Bye,
Tori.
guys.